Hi, my name is Jason Garcia. I use they, them, theirs pronouns, and I am a Pisces sun, Virgo rising, and as well as an Aquarius moon. It means I love to feel things, but I like to hold back the important stuff.
Thank you, Jason. And my name is Thomas. I'm a Libra sun, Cancer moon, and Aries rising. We knew he was going to come up, so we just decided to put it over there. Our Instagrams are to be determined personally. Very happy to be here. Thank everybody for having us. And we're going to divide this presentation. Jason's going to start giving some introductions. We'll both share a little bit of the end as well as the middle. So thanks.
Yeah, so we got to do this work with the Edmonton Men's Health Collective, which Thomas and I are both affiliated with, and we operate mainly in Treaty 6 territory, most notably in the areas where the Cree, as well as, the Cree, Dene, as well as Misplaced Inuit, Métis, and Ojibwe and Anishinaabe folks back home, as well as many other Indigenous groups in what is known colonially as Edmonton, but formerly known as Misquiji Wasgahigan. And so, yeah, next we will move on and talk a little bit more about what we did, but first we're gonna set the tone for some reflection on your parts as people who, at least we think this kind of work should be a priority at the very least. So when we think about accessibility, we also oftentimes think about inaccessibility. So we think about, most importantly, what inaccessibilities exist in queer spaces. I think there's been a lot of reflection already with some of the speakers, especially just after the plenary offered by Andrew Garcia. The second one, y'all didn't think I was gonna get restorative justice on your butts, did you? But here we are. What harm caused leads to cancel culture? I'm gonna ask very quickly, does anyone have a quick answer for that? What kinds of harm oftentimes leads to us canceling those within our communities? Even just shout it out, just something quick. Misogyny, cool, okay. Any other guesses? Any other takes? Sorry? Abuse. Yeah? Any other ones? Maybe one or two more. Trauma. Ooh, that's a big one. And lastly, which I hope, you think about not just from our presentation, but as well as just in general. On the other flip side, not to make it so binary, but of the spectrum, what harm oftentimes results from cancel culture? Or what does it mean when we have an impact on those that we might care for, live in the same communities for, and breathe the same air and space as those who we cancel? And so to give the Edmonton context behind what prompted us to do this work, as you all have probably heard, we have had some cancellations back home in Edmonton, not just with our Pride Festival Society, but also with our Pride Center. Something that straight people don't realize, that both of them are two different things in our city. So a bit of the, Cliff's notes on just the very short history behind that. We see a lack of meaningful representations for folks with intersecting identities in queer spaces and services, most notably those who identify as part of the QT BIPOC collective. We see continued harm and re-traumatization by all levels of services, and of course within our own communities as well. And when you have that by service providers who are supposed to be inclusive of all identities, that gets really tough, especially for those folks who are underrepresented and underserved, quite frankly. So we see a bit of a rise in resiliency of QT BIPOC organizing, and thus for a continuance of neglecting the concerns that were brought forward by them. Two very notable groups that we'll mention is Shades of Color and Rara Now, two very prominent advocate groups that brought a lot of light and attention to this and ultimately received the really, quite frankly, harmful end of the stick, being blamed for the cancellation of Pride in Edmonton, which, was a decision made by board members who chose not to hold themselves accountable to continuing the good work and to actually fulfilling the concerns that a community who's been harmed were bringing forward. Similar with the Pride Center and the shutdown there, we see just a little bit of a similar thing, but within a specific service where we see the phasing out and, quite frankly, the firing of people who hold racialized identities in roles of prominence and thus without power. If you've ever seen the meme, the problematic woman of color in the workplace, it's essentially been that over and over and over again for the last decade or so.
Thank you, Jason. So how did we approach this, right? I think with the Edmonton Men's Health Collective, it became a matter of how do we make sure, not that we don't get canceled, right? Because I think that sounds like a selfish and, self-serving thing. But how do we make sure that we remain accountable? Because as we know, language changes really fast. Our knowledge changes really fast. And we're very fast unlearning many things that took us many, many years to learn. So as an organization, how do we remain accountable? How do we make sure that we continue to represent the people that we're serving? And how do we establish systems within that organization so that we can show and say like, hey, this is actually how we are representing folks, creating those methods and creating something more sustainable and structural, which we can perhaps repeat in 4 to 5 years or so to reassess and make sure that, okay, what are considerations? What does accessibility mean for the population that we serve? What does it mean in theory, but also mostly what does it mean in practice, right? Because that is also often changing. So the methodology that we came up is that we first engage with local partners, right? I think everybody doing this work knows that replicating and duplicating work is far from what we want to do. So we reached out to those groups because we're also very aware that we serve and we represent a very small, a very specific niche and a very specific group of people, right? Queer and trans folks, queer and trans guys. It's getting more and more fluid. So we consulted with local groups, so groups representing exactly those intersections. So as Jason mentioned, Shades of Color is a group in Edmonton that does a lot of work and advocacy for people who are LGBTQ and racialized. Rarika now does work with people who are refugees, newcomers, and immigrants. We also engage with the Edmonton Association of the Deaf. We don't have a specific trans and non-binary group, but we engage with local trans non-binary leaders as well as social media networks. As well as with the Edmonton Two-Spirit Society. So we talked to those groups, and when we were approaching them, the question was very simple and straightforward. It was like, hey, we're doing this is our idea, you know best about the population that you serve, but we also want to make sure that our services, are inclusive, so how can we work with this? So we consulted with groups, we engage with local partners, and to actually ask how can we best recruit folks, because again, we don't know what works for every population. So for some groups, we did the recruitment. For other groups, the recruitment was done by the groups themselves, but most of it happened through social media. We had some funding, luckily, so we were able to boost ads, we're able to monetize our consultations, and we advertised them online as being paid consultations. So I think that really helped because people really like to get paid, surprise. But also, I think it speaks to the larger system that we are very often not paying those key informants, right? And those key informants know that they're not getting paid. So if you're gonna get them to inform you and you don't pay them, they're gonna know for next time. So one of the main things that I think made this successful in terms of reach, we had about 34 people, and it was very qualitative, was the fact that those were paid. So if you are to establish something like this, I would very much advise to have a little bit of funding, not only for monetary compensation, but also for transit and such to make those as accessible as possible. So we delivered those consultations in partnership with those groups. Those groups were also themselves getting paid a little bit more to facilitate those conversations as well as to help take notes. We had volunteers and staff as well. So those groups were getting, again, some money themselves to facilitate those conversations because, again, I don't have that trust build with every single group. So we'd rather let it being the knowledge keepers and the leaders with those intersectional communities. So after that, our lovely Kirk here, sitting our moderator, looked over a bunch of the data and kind of gathered the common themes of the data that we analyzed and we're going to be speaking a little bit more about. And then we are still in the process of figuring out distribution and delivery, but we also talk a little bit about that. So in terms of findings, also all the photos were taken by a local photographer called Liam McKenzie. His Instagram is right down there, so if you could give him a follow, that would be great. Support local artists, thank you. So when we found some stuff, we found some common themes and some group-specific themes, right? So we just categorized them in common themes that we found. So the first barrier, lack of culturally sensitive care that reflects intersecting identities. To me, like, we also consulted with a group of LGBTQ newcomers, and that was the main concern for that group, right? They were scared that if they went to the STI clinic or to pursue any kind of healthcare, they would have to either choose to face the homophobia or the racism, and they didn't know how to negotiate that being a newcomer in a new context in Canada. Needing support, navigating pathways to care, people had no idea how to access PrEP. Like, in terms of knowing what it is, how it works, yes. However, how much it takes for baseline testing, how much it takes for monitoring follow-up, people had no idea how to access trans-competent care in terms of pathways. Like, from the point of how do I start looking for a doctor to the point of, finding the full realm of care. So people were really interested in looking for easy information around pathways to finding care and being maintained in care. The emotional labor required of queer and trans communities was one of the themes that were very highlighted. People were just complaining. It became almost a consciousness-raising group from kind of early feminism times, going back to academia because that's my sociology brain. But people were just really speaking to the trauma that they had in those healthcare fields, right? Those groups were just saying, like, yes, I had to go and I had to teach my doctor, and they even didn't get specific and appropriate care after that. So folks are really being put in a position where they not only have to educate their peers, right? If you think about trans folk, non-binary folk having to educate people on dating apps, as well as those on PrEP, people are really having to educate their own providers, which, in my opinion, shouldn't really be happening. Providers already make enough money, so that community has to educate them on their own time. The language used is also often very, very clinical, very, very medical, and very, very stigmatizing. Language that does not truly reflect the different levels of literacy, language that is not translated in different languages, language that is perhaps only in English and French if it's a really good resource, but really no other kind of symbols or alphabets of different cultures are used to even have a bit of more of a connection. And we know that visually those materials usually represent the same population that has HIV education cater for them, right? Which is cis, white, gay guys. But other than barriers, people identified a lot of opportunities. And I also like to think that although we are living in very dark times, the climate is going to collapse. Sheer almost won, oh my gosh. For as many barriers as there are, I would say that there are opportunities, right? And those groups are focused on those opportunities. They're tired of talking about barriers, they're tired of talking about what's not working, and they're ready to talk about how to get over it. So that's what I find very rewarding with working with community, is that everybody that's working in systems is a bit jaded, and we're just like, well, we can't do this because of that. But community really has that, well, what if, and it's kind of about feeding that what if that gives me hope in the world. So populations really emphasize peer support services as being a need, right? So being educated by their peers, but also making sure that those educating are receiving enough supports and also being monetized for their work. And also offering culturally specific resources, and that can take many, many kind of formats that people discussed. But in the interest of time, I would just make sure that we have enough space for a conclusion and some questions.
No, there's no questions.
After.
Okay.
Great. So in terms of what's next, of course, I mean, for us, as we mentioned, we're hoping to have an accessibility action plan to share, just to kind of really honor the findings and the voices that have gone into it with additional review. For anyone, if we recommend anything for you folks engaging in similar work, pay people for their freaking labor. It is emotional labor. Yes, thank you. Especially for some of the words that some of you threw earlier, trauma, abuse, power, like when we think about the weight of those words and the harm behind that, it isn't so easy just to expect people to just spill their traumas, as well as consider in what space and what ways you reinforce accessibility by getting that information. So this work, I hope we don't have to prove why it's important. Clearly, many of you should know and can reflect on that. And lastly, in terms of what we ask of all of you in this room, is just consider how you will engage with cancel culture and what it means to cancel those who are also living in the same reality as you, but might have different experiences, because there's probably a lot of harm and a lot of trauma and abuse behind that, as you folks shared. Lastly, we just want to say thank you to not just you for listening to us, but of course to all of our many participants, to the Edmonton Community Foundation, who in part of their grant helped us do this work, and to, of course, the EMHC for the platform for us to complete it. Other than that, our emails are on there if you have any questions not in this room.
Thank you both very much.